Thank you very much. Still standing on the existing protocol, I'll be taking devices in management of asthma, precisely the inhalers, the nebulizers, and peak flow meters. But before I go ahead, I want to appreciate my trainer, Professor Gregory Rabo, for the opportunity to present on this platform. I also like to acknowledge Asthma and Chest Care Foundation, Getz Pharmacology, the pharmaceutical company, and the other panelists that have spoken ahead of me. All right, the learning objectives for this teaching include one, we want to know about the different types of inhalers and also learn the correct inhaler techniques and then to know briefly about other devices. What are inhalational devices? Simply put, inhalational devices are devices that make aerosols from drug solution or solid particles. And treatment of respiratory disease by inhalation is a form of therapy which has been used for so many years. And I'm happy to say that delivery of most of our asthma medications are via the inhaler devices. Now, what are the advantages of inhaled therapy? Not only does it ensure direct delivery of the drug to the site of action, it also ensures rapid onset of action. In addition, lower doses of the medications are required to produce the desired effects when compared with systemic administration. Then there's also minimal systemic adverse effects. Now, the effectiveness of an aerosol is largely dependent on how much of the medication actually reaches the small peripheral airways. Therefore, it is so important to talk about the factors that affect lung deposition of medications. And the first factor I'm going to talk about are the particle sizes. It's been found that particles greater than 5 microns and above, they often deposit in the oropharynx and also the large airways. And particles that are less than 0.5 microns are so small that they pass out with expiration. Particles between 0.5 to 5 microns, however, they have the optimal bronchoalveolar deposition. And thankfully, most of the current devices we have available generate aerosols with significant proportion of their particles in the range of 0.5 to 5 microns. Another important factor that affects lung deposition is the inspiratory flow. And it's been said that inspiratory flow between 30 to 60 liters per minute often suffice for optimal bronchoalveolar deposition of medications. Now talking about the proper inhaler technique, an adequate and effective dose of inhalational drugs can be administered only if correct inhaler technique is followed by the asthma patient. Therefore, the role of proper inhaler technique cannot be overemphasized. It's been found that incorrect inhaler technique leads to minimal therapeutic benefits with subsequent increase in the use of the liver medications, also increase in the use of the emergency services, and also worsening of asthma control. In a well-conducted study by Brokelbaum et al., it found out that about 23 to 43% of patients on the meter-dose inhaler make no mistake using their inhaler. What this means is that close to 60% of patients on meter-dose inhaler are using this inhaler incorrectly. Then, in this same study, following the teaching, just like the teaching we're going to do today, they found out that there was improvement in the correct usage of the inhaler to 63%. And as a result of this, the British Thoracic Society, as well as the Scottish Intercollegiate Guideline Network of 2019, they've recommended that inhalers should only be prescribed after patients have received training in the use of the device and have demonstrated a satisfactory technique. Now, in Nigeria, a study was also done by Oyedo et al. On the evaluation of inhaler techniques among asthma patients seen in Nigeria. And surprisingly, it was only 50% of patients on inhaler that used their inhalers correctly. Now, what are the types of inhalers we have? We have the pressurized meter dose inhaler, which can be used with or without the spacer device, the breath activated the PMDIs, then the dry powder inhalers, and also the nebulizers. Pressurized meter dose inhaler is the most common device for the inhaled drug delivery, and it consists of a pressurized canister and a chamber outfitted with a mouthpiece and also a protective covering. The canister contains the medication and also a solvent as well as liquid propellant. And this inhaler is actually designed to deliver the exact dose of the medication. It's important to note that aerosol inhalation has to be coordinated with dose actuation. Now, how do we make use of pressurized meter dose inhaler? The first step is to remove the cap, and this is very important because I've seen a couple of patients that use the inhaler even without removing the cap. After removing the cap, then we tell the patient to shake the inhaler. Then the next instruction is for the patient to exhale, to breathe the way out. Following that, the patient puts the mouthpiece in between the teeth and without biting the mouthpiece, and then seals his or her lip around the mouthpiece. We ask the patient to continue to breathe in. Thereafter, patient can actually actuate the pressurized meter dose inhaler while still continuing breathing till the lungs are full. After this, the patient removes the inhaler, holds his or her breath for like 10 seconds, and then exhale out slowly. Now, I just want to take a moment to demonstrate this technique to us. This is a this is an example of a pressurized meter dose inhaler. So the first step, I remove the cap, then I shake my inhaler, then I breathe out, then I put the mouthpiece in between my teeth with the lips sealed around it. Yeah. Another important device is a spacer device. Like I said, the pressurized meter dose inhaler can be used with a spacer device. The spacer device is an extension add-on device, and it permits the aerosol plumb from the meter dose inhaler to expand, slow down, then turning it into a fine mist instead of the high pressure actuation spray that is seen in the pressurized meter dose inhaler. And the spacer device is so important because it compensates for poor coordination between actuation of the pressurized meter dose inhaler as well as inspiration. And this is especially important for patients that are physically challenged or mentally handicapped, and also in children. The spacer device also reduces the oropharyngeal deposition of the particles, as well as improving the deposition of these drug particles in the lower airway. And according to the Nigerian Thoracic Society guideline for asthma management in Nigeria, which was shared by our own Professor Rabo, the spacer device has been recommended for administering of inhaled medications during severe asthma exacerbations. Now, how do we make use of the spacer device? Just like before, the first step, I want to open my inhaler. This is the pressurized meter dose inhaler. I want to remove the cap, then shake the inhaler, then attach the pressurized meter dose inhaler at the end of this spacer device. Then I tell the patient, just like we did for the pressurized meter dose inhaler, ask the patient to breathe out till the lungs are empty, then put the mouthpiece in his or her mouth in between the teeth while sealing the lips around the mouthpiece. Ask the patient to start inhaling and at the same time actuating the medication, and then continue to breathe for like 3 to 5 seconds. Patient can remove the spacer device and then hold on the breath for like 10 seconds. Another important device is the breath actuated pressurized meter dose inhaler, and this actually senses the patient's inhalation through the actuator and fires the inhalers automatically in synchrony with the patient's inspiration. The concept of the breath actuated pressurized meter dose inhaler is actually a good one because it solves the problem of patient's coordination of actuation with inhalation. The dry powder inhaler is also another important inhaler, easy to use because they are actually breath actuated. Now, nebulizers. Nebulizers are devices that transform solutions or suspensions of medications into aerosols that are optimal for deposition into the lower airways. And nebulizers make use of oxygen, compressed air, or ultrasonic power to break up the medical solutions and suspensions into small aerosol droplets that can be directly inhaled from the mouthpiece of the device. There are different types of inhalers. We have the nebulizers. We have the jet nebulizers, ultrasonic nebulizers, and also the mesh nebulizers. And a major advantage of the nebulizer is it requires minimum patient cooperation and coordination, and as such is indicated in patients with life-threatening asthma and also patients, small children, infants that can't cooperate with the use of inhalers, as well as unconscious patients. The disadvantages, it's cumbersome and time consuming. And in this era of COVID-19 pandemic, there has been concerns as regards the risk of transmission of SARS-CoV-2 with nebulizers. And as such, nebulizers are indicated when patients are in life-threatening condition or in unconscious patients. Sorry, time will not permit me to take us through how to use the nebulizers. Now, I'd also like to talk about the peak flow meter. The peak flow meter is inexpensive portable handheld device that is used to diagnose the asthma and also for monitoring. It measures the peak expiratory flow rate, and which is the maximum flow rate generated during a forceful exhalation starting from a full lung inflation. The advantage of the peak flow meter, it is affordable, easy to use, is portable, and can be used at home. And every asthmatic patient should have a peak flow meter. It's useful, just like I said, in diagnosing asthma as well as monitoring the progression of the disease. How do we make use of a peak flow meter? The first step, we, we ensure that the pointer is at the 0 point. Then the patient can be seated or can stand upright. We ask the patient to take a deep inspiration to inhale to the maximum. Then we ask the patient to put the mouthpiece in between the teeth and seal the lips around the mouthpiece. Then the patient is then asked to blow hard and fast in a single blow. Now let me demonstrate this. I'm seated. This is the peak flow meter. My first step, I put it at the 0 point. Then I take a deep breath. Yeah, 650 liters per minute. Yeah, and that's all. In conclusion, inhalation devices are devices that make aerosols from the drug solution or solid particles. A number of inhalation devices are available for the treatment of pulmonary disease. Proper inhaler technique is the key to successful treatment. Thank you for listening.